This is Dr. Michael Ryan answering the question, what causes my veins to pop out in my arms and legs? And really, there's a couple things that will do it. Most of the time, visible veins in the arms and legs is completely normal, and it's due to a couple of factors. One is when you're exercising, using the muscles, there's more blood flowing to your arms or legs. And when there's more blood flowing, it has to return back from the arm or leg back to your heart to continue cycling. And the way it returns back to the heart is through the veins. So if more blood's going to your leg or arm, more visible blood will be present in the veins. So that's one reason. Another reason is really based upon your percent body fat. People with a lower percent body fat will have the veins in their skin become much more prominent and visible. This is because the veins lie in that area of the skin just under the dermis, which is the top layer. And if there's less fat, the vein is filled with blood and will become more prominent as the skin kind of falls and covers it and drapes over the vein. So that's a very common finding. In terms of normal function for women during pregnancy, the blood flow increases and it actually doubles. And so there's more blood going everywhere throughout the body because the blood flow has to go to the uterus and the fetus. And because of that, women during pregnancy often have very visible veins because of that very simple reason that they have more blood flowing throughout their body. So often a pregnant woman will have very prominent veins in their arms as a result. In some cases in the arms, but more commonly in the legs, if the veins are not functioning normally, they can back up under pressure. And the situations for that, uncommonly in the arms, is when there is a blockage in the vein in the in the neck or the upper chest. That's very uncommon, and probably the most common scenario is when someone has a condition where the vein under the collarbone gets crimped off by the first rib, which is right next to the collarbone. Another is very uncommonly when someone has a long-term IV in place that travels in under the collarbone, and that can sometimes cause that vein to clot off and form a clot. If that happens, then the veins in the arm that's affected will become more prominent. Similar situations can occur in the legs where you have a blood clot, and when a blood clot occurs, you can have prominent veins. More commonly, you will have a lot of swelling, and the swelling will actually obscure the visible veins. More commonly in the legs, the veins stop working properly. It's called vein reflux or venous insufficiency. And when that happens, the veins are bulging under pressure and they become very distended. The pressure causes the vein to kind of widen and dilate. And so they become, or can become, quite visible. Not everyone with a vein condition with that vein reflux has visible veins, but often they do. More commonly, people simply have a lot of aching, fatigue, cramps, restless legs in their legs, but no visible veins are present. And the only way you know that that's what's going on is getting an ultrasound, which allows the medical professional to sort out what's going on in the circulation. And then in that case, those people can be helped. This is Michael Ryan answering the question, why do veins in the arms and legs become distended and visible?